Well, smile beauty is really that phenomenon of pleasure that we get when we perceive facial balance and proportion. And that's really the key to a smile. If you want to make a smile look natural, what we need to do is look at the face and then build the smile to that. That's how you can create a really customized smile. So I can put the shapes in with DSD. I can put the contours. I can put the sizes of the teeth down to 1/100th of a millimeter and translate that information to my laboratories. And then we can put in shade and pick whatever color we want. Most people want white, though.
Right.
Not purple.
As white can be, like the snow. How does a smile makeover work?
Well, what we do in the smile makeover is first we have to meet with the patient, discuss their goals, then I'll do the digital smile design, and we can show the patient a simulation where I can take my iPad and I can actually put the digital smile design program on it, and I can take a few pictures, and then just like an artist, I can kind of like design the smile and share that with the patient. From there, patient says, yes, I want to do it. I'll send that information to the laboratory, and my oral design ceramist, Peter Kavaris in Manhattan, or Pinhas Adar in Atlanta, can translate that to a 3D, and then it's my job as the dentist to prepare the teeth, make the mock-ups, and then they'll make the porcelain, and then we deliver it. And all in about 3 appointments.
Okay. 3 appointments.
Three appointments.
That's amazing. And you do a lot. You do FaceTime and Skype and stuff like that too, right?
Right. We can do a FaceTime with the ceramist in Atlanta or in Manhattan, so you don't have to fly there, and they can meet you, and we can all three kind of coordinate the case and really dial it in for the patient.
So just to understand, if someone watching right now has failing teeth, what happens?
Well, in a failing tooth case, those patients, usually their teeth are going to have to be lost. And so what do? We don't do porcelain veneers, but we do a process where I work with my surgeon and we take the teeth out, we put in dental implants all in the same day in about 4 hours, and they leave with teeth that are screwed onto the implants, and they have a smile that day. So imagine that. You lose your failing teeth, you get implants, you get a new smile put in, then about 90 days later we make a prototype off of the healing one, and then we make the final in zirconia. Wow. And so you can have that grabber of a smile like I delivered yesterday in about 5 minutes, the final smile for the patient, and he's like, wow, I can eat again. Yes. I don't have to have my teeth in a jar every night and all that kind of stuff.
It really is a miracle what you can do.
I mean, but what you're doing is artwork. Like
yes,
you're creating
exactly, it's artwork. And with the digital smile design, what we're doing is we're designing that smile in such a way that it's like an artist using as I said, like using a canvas, except it's digital.
Right.
And the nice thing is I can share it with my specialists, I can share it with my laboratories, and that's the key. People want a smile that looks natural, looks like it's their smile, and it's not somebody else's. But we can take somebody else's smile. Like I had a patient in yesterday that wanted to have a smile that looked like Dr. Christian Coachman, who is the founder of DSD. We actually have his teeth on templates and other people's teeth on templates. And I'm able to put that into that person's smile and then customize it and give them that general look.
Okay.
That's amazing.
Awesome stuff.
That really is. How do implants help in all of this?
Well, the implants, these are the cases where people are going to lose their teeth or they have already lost their teeth, and the implants act like roots, okay? And so we put a bridge on there that's screwed on, so it doesn't come in and out unless we take it out. And the patient, it's made of zirconia, the hybrid bridge that we put in, so it's extremely strong, and with Pinhas's help, with his talents, we're able to create gums and teeth that look like real gums and teeth.
Yeah, and doctor, you brought people on here, your clients, who have actually like teared up and cried because they're talking about how this has changed their lives.
Well, think about it. I mean, they probably couldn't even eat.
Yeah.
Oh yes, we have patients that